All right, my phone is saying it's 1 o'clock, so I would like to now welcome everyone who's joining this webinar. The title of this webinar is Restorative Practices and Community Health. This is a somewhat new direction, although it feels very synchronous with a lot of things that we've been doing at the IRP, but specifically relating the field of community health to restorative practices. It's a very exciting direction that the field is taking. So we're glad that you're joining us to learn a little bit about this, which has been the theme for the last couple of conferences, part of the theme of the last couple of world conferences that we've hosted, and will be the theme for our Summer Symposium and also for our next World Conference coming in October in Bethlehem. This webinar is titled Restorative Practices and Community Health. Whether your community is a big city, a small town, a neighborhood, a school, or other grouping of people, we want people to be healthier, happier, and more likely to make positive changes. During this brief introductory webinar, you'll get an overview of how the fields of restorative practices and community health can work together towards these ends. So we're expecting to give you a real teaser and an idea of how these fields can work together. If you're expecting a comprehensive overview, that's going to be forthcoming. It won't be you're not going to learn everything during this webinar, but we're really excited about what we do have to share. You may communicate with each other through the chat window today. All the participants are able to communicate there. We also have question and answers open. So if you want to ask a question, please, you may do so there. That's going to be an easier way to keep track of all the questions and make sure that we're not missing things. So please do use that feature. We're gonna have our presenters present first, and then we'll be taking those questions and answers in the last period of this webinar. So if you're new to the IRP, you should know that our website, iirp.edu, has a lot of information about our programs and also has extensive resources that you can tap into. We have introductory video about what is restorative practices, which you can share with people who are interested in the field. We offer our basic restorative practices course at locations across the country and around the world, which is a great not only introduction, but actually gets you into the skills of doing restorative practices in your setting right away when you leave those that event. We also offer graduate education, and those courses may be taken as long as you have a bachelor degree, and you can find out how to do that on our website. And we also offer world conferences on a regular basis, and those are open to anyone. Anyone may participate in those events, so we welcome you to look into that and find out what is coming up. Well, it's about 5 minutes past, so hopefully anybody who has is logging on will get started for those who are here. So again, this is Restorative Practices and Community Health. This is a webinar that is going to give an introduction to how these two fields are working together. And I'd like to begin with our first guest, Dr. John Bailey, who's the president of the IRP and also assistant professor. And he's going to discuss a little bit about the fields of restorative practices and why we are excited to be bringing these two areas together and why this is important direction for restorative practices to be taking. Are you unmute, John? There you go. All right.
All right. Thanks, Josh. And thanks everyone for joining. It was exciting to see the spread of people on the webinar, and so many. So as you know, as the numbers on the webinar, I think suggest, and as our experiences over just the last couple of weeks, many of us were touring different parts of Europe and visiting with different communities across that particular continent in preparation for our European conference that we just had in Belgium. And we saw on the ground, I certainly saw on the ground there in the communities I was in, the same kind of response that we're seeing here on the webinar. And that's really, I think, the coming of age of social science, which, you know, I think back 20 years to those of us who helped to build the IRP graduate school. You know, one of the things that we've been saying recently, if we accomplish nothing else other than, you know, some of the great outcomes we've seen on the ground with schools and helping to transform the practice of justice, counseling, social work, organizational leadership. But if one of the things we can have contributed, you know, 50 years from now, 100 years from now, that people could look back on and say that was the beginning of a new social science, I think that will have been a job well done. But to say that is one thing, and to actually do it is another thing. And, you know, on some level, I think it's a daunting task. But the way that we articulate why the world needs a social science and what that social science is pretty simple. You've probably seen it on our website, or you've seen it at some of our other events, and that restorative practices is the science of relationships and community. So that has drawn, this experience in working with the science of relationships and community has drawn lots of insights from fields of education, from psychology, from anthropology, from organizational management. Increasingly, we have some new fields like neuroscience is telling us a lot about the psychology of belonging and things like the effects of conflict and trauma, you know, not just on the brain, but on our, you know, our physical health as a whole. So all of that has coalesced around this one particular idea of, especially at the beginning of the 21st century, as we find ourselves, all of us, in a world that's increasingly diverse, more mobile, where social patterns that have characterized not just the last few decades or even the last century, but have characterized several hundred, in some cases thousands of years of human history, are suddenly changing. How we build and form bonds with one another, what we consider to be community, is it no longer just a geographical place, but potentially for many of us a worldwide web of relationships. And then for those of us with a worldwide web of relationships and a sense of community that in some ways, you know, spans the globe thanks to inexpensive travel and digital communications, how does that conflict with and create tension with those of us who don't have those kinds of privileges and sense of community, where their sense of community is still quite local and small? These are all the questions that I think this new field is beginning to tackle. And it goes beyond some of the work that we've done over the last decade or so that at least our own institution is most known for in schools and criminal justice, towards thinking more broadly about what has ultimately always been the IRP's mission, which is to improve civil society itself. So if we're serious about improving civil society itself, not just in a sort of secondary effect of making systems more effective or relational or humane, we have to start taking those deeper social questions much more seriously. One of the ways we're doing that is by exploring and really trying to build new connections between the field of restorative practices and the field of community health. For those of you who are interested, I spent the last couple of weeks touring around a lot of communities in Europe, some of whom have a lot to teach the world, frankly, about the nature of community, where community, as it always has been for hundreds of years, wasn't lost. I was in a lot of small villages in Romania and Hungary and other parts of Eastern Europe, where there's a lot of things about life there that someone like myself, when they spend a week there, really yearns for it and mourns for it when it's gone. But at the same time, a society with a lot of cultural tensions, religious tensions, tensions between new people who are joining their national community. And, you know, of course, in the Eastern Bloc, in that particular case, a lot of traumatic history to deal with and contend with. So, you know, other than the traditions or things that we may have just learned along the way over the generations, I think the field of restorative practices, and I was there as much to learn as to teach, but one of the things I did talk about is, moving forward into a new century where we're not all just living in the same place where everyone we're related to has lived for 400 years. We need a much more explicit and concrete understanding of how bonds and relationships are formed in the first place. And not only that, but when they're weakened or damaged, whether that's by historical events, trauma, or just the pace of change, how does one go about proactively, on purpose, actually reconstructing community? If we're not just going to depend on the sort of organic long-term drift of communal development in history, how do you do it on purpose? How do you do it on purpose on a college campus? How do you do it on purpose in a small village where the ethnic makeup is changing rapidly? How do you do it on purpose in an organization? Or if increasingly, say, with our K through 12 schoolwork, if you're thinking about not just helping students behave, but also thinking about what would a new system of education look like that's not just built for the industrial era, but that's built for the digital era, that means you need an entirely new model for what community is, especially the community that exists outside of the institution's walls and how we should be interacting with it. And part of that, and one of the ways we've always done that, is to find the smartest people that we can to help expand the field. And one of the ways we did that was by, of course, meeting Henry McClendon, who you're going to have a chance to meet on the call, and bringing Dr. Abrams onto our team as our director of program evaluation and research, and bringing her onto the faculty, as well as the deep well of experience within the field of community health that existed before restorative practices, but I think the links between the two are increasingly very exciting. So hopefully that gives a good kickoff into what we're going to discuss here and later on in the symposium this summer.
All right, thank you so much, John. So the next person we're going to hear from is Dr. Gina Abrams. She has worked for more than 2 decades in the fields of public health and community health. And she's going to speak a little bit about how these two fields, community health and restorative practices, some of the ways that she sees that they fit together, and why she is really excited to be taking her experience from community health and applying it into this arena. And then she'll also discuss a little bit about the symposium this summer itself and what to expect there.
Great. Thank you so much, Josh. I'm very happy to be connecting with you all today. As Josh had mentioned, before joining the IIRP faculty in 2017, I worked as a public health practitioner and macro social worker for 20 years. And I always appreciate the opportunity to discuss the value of a community health approach to effecting change. First, I want to acknowledge that there's no universal definition of community health. But the one that I appreciate most is from a 2014 article in Preventive Medicine, which poses that community health is a multi-sector and multidisciplinary collaborative enterprise that uses public health science, evidence-based strategies, and other approaches to engage and work with communities in a culturally appropriate manner to optimize the health and quality of life of all persons who live, work, or are otherwise active in a defined community or communities. There's a lot in there. So from an applied perspective, I want to focus on 5 hallmarks of community health that I believe are synergistic with the field of restorative practices. And notice that now I'm not going to talk about specific interventions, but hallmarks and processes that can be transferable to a variety of settings. First, when we talk about community health, we understand that community is defined broadly, historically as anything with functional spatial units, units of pattern social interaction, and symbolic units of collective identity. But as John had mentioned, in today's virtual culture, the boundaries of functional spatial units are reconsidered, and we are defining community in new ways. Regardless of what your community is, whether it's big or small, personal or professional, we must build on the interrelationships and interdependencies among the members and contextual systems to influence health and well-being. In transient communities, including educational settings, the unit of change cannot only be the individual who has a limited time in that community. The units of change must be the individual and the community, and leaders must aim to create health-engendering environments for all members at any point in time, regardless of who chooses to come and go within that community. Second, community health focuses on the determinants of health. And I want to quote from Healthy People 2020, which provides a comprehensive set of 10-year national goals and objectives for improving the health of all Americans. Healthy People 2020 envisions a day when preventable health, illness, injury, and disability, as well as health disparities, will be eliminated and each person will enjoy the best health possible. This transformation will occur by changing our thinking about health, examining root causes and social determinants, and directing more interventions to address primary causal factors that affect health. Healthy People 2020 also acknowledges that in the United States, we spend trillions of dollars on healthcare, yet it only determines about 10% of our health. The remaining 90% of what determines our health as a population is our total environment, including the social environment in which we live, which accounts for 40%, plus our health behaviors, and to a lesser extent, our genes and biology. The Centers for Disease Control and Prevention defines the social environment as the aggregate of social and cultural institutions, norms, patterns, beliefs, and processes that influence the life of an individual or community. Social determinants of health refer to the set of factors that contribute to the social patterning of health, disease, and illness. Addressing the social determinants of health is a primary approach to achieving health equity and well-being. Third, as we know, 80% of restorative practices is intended to be done proactively. A hallmark of community health is the emphasis on prevention. And prevention is differentiated from treatment and maintenance as everything before the point of diagnosis, or in restorative language, as everything before the point of harm. This is where reorientation to an assets or strengths perspective is so important. An explicit restorative practice is certainly considered a strength-based approach and a facilitating factor that can affect many areas of health risk, overall health status, and the well-being of a community by improving relationships, increasing social connectedness between individuals and groups, and increasing sense of personal and collective efficacy, which the research shows can improve sense of community, including belonging, as well as flourishing and thriving. As an example of this connection, longitudinal research in flourishing shows that positive affect plays a role in the development of well-being. And if we recall psychology of affect and Tompkins' central blueprint, which is a key element of explicit restorative practice, we are called to maximize and mutualize positive affect. Therefore, I believe that we must focus more greatly on the 80% proactive practice and start using new language to acknowledge restorative practices primarily as a prevention strategy that creates the social conditions to advance the health and well-being of a community and its members. Fourth, community health applies a socio-ecological based approach that examines and addresses health issues at multiple levels of influence: intrapersonal, interpersonal, institutional, community, and public policy. This is also congruent with the settings approach. And the World Health Organization defines a setting as the place or social context in which people engage in daily activities in which environmental, organizational, and personal factors interact to affect health and well-being. And in our explicit restorative practice as a prevention strategy, we must think more ecologically and expand our unit of change from the individual learner, regardless of position of within the community, to include the environment in which they exist, which includes the influence of policy. The IRP founder Ted Wachtell stated that if systems are not innately restorative, then they cannot hope to affect change simply by providing an occasional restorative intervention. Restorative practices must be systemic, not situational. This is an important sentiment, and I want to amend the last sentence to reflect the community health perspective. Restorative practices must be systemic, not situational, and be integrated at all levels of the socio-ecological model. Lastly, one of the hallmarks of community health is a multi-sector or cross-functional process. Well-qualified health Community health practitioners are trained to mobilize multiple partners within a community to examine and address the determinants of health within that community. There are many cross-sector models currently used, and often these models begin with forming a shared vision or mission or common agenda, and then move to sharing data and creating a plan. However, getting the right people in the room is not enough. Successful cross-sector efforts need an explicit model for how people will work together toward that common agenda. And herein lies the gem of restorative. We must think about these efforts as collaborative learning opportunities that use explicit restorative practices to create a deliberate and shared experience, foster relationships and mutual understanding, and overcome resistance through trust. We cannot focus solely on product. We must be more intentional about group dynamics and process. An explicit restorative practice can further dialogue versus discussion, listening versus speaking, and deeper creativity in problem solving. Also, existing models for multi-sector collaboration that are tasked with improving conditions in the community often overlook the importance of building the community's capacity to solve their own problems. Intergroup dialogue is often essential. And the fundamental hypothesis of restorative practices invites us to do things with those most affected in the community and not to or for them. So here's my Cliff's Notes and what we will explore more deeply in the 2019 IIRP Summer Symposium. By recognizing that community can be defined broadly, by being explicit in our restorative practice as a prevention strategy at all levels of the socio-ecological model, focusing on the social determinants of health that affect health and well-being, engaging multi-sector partners for a collaborative learning experience, and working with those most affected in the community to build capacity to solve their own problems, the benefits will be systemic and sustainable. We've also built in time during the symposium for you to explore these concepts and generate ideas for you to explore these ideas and ideas for application with others in similar settings so that the experience will be most relevant to you. And I hope that you will join. Josh?
Thank you, Gina. Thank you very much. So if you're joining a little bit late, we are talking about community health and restorative practices. If you have a question, please use the question and answer feature, and we're going to get to those in just a few minutes. Right now, we'd like to turn the microphone over to Henry McClendon, who's the IRP Regional Representative in Michigan. He's been working in different capacities with the IRP for over 10 years, and he's done extensive work in the city of Detroit. And they are doing some great work in their community and using restorative practices and the community health model thinking to make changes to that city. So Henry, would you please give all the viewers a little insight into what is happening there in Detroit?
Sure. Thanks, Josh, and to looks like 172 people that are online. Great to have the opportunity to connect with you. So yeah, Detroit, we started out, I think my first contact with IIRP was probably 2007. And the goal was always to introduce the concept of restorative practice. And over the years, we've attempted to work to build an awareness. There was very little awareness of restorative practice at all in this community. But we've worked diligently to try and raise that awareness to the point in 2016, we began an effort to build what Dr. Abrams mentioned, integrated, infusing restorative practices at multiple levels. So to be more explicit, we set out a goal of young people being safe in community and successful in school, and with the idea of using restorative practice as a part of a way of building the relationships that would be necessary to help make that happen. So we identified an area, it's called the 9th Precinct, or the Osborne school area, Osborne-Denby school area, to begin putting an emphasis on raising awareness both of restorative practice and its implementation. So if you think about multi-level at the grassroots, so we have neighborhood block clubs that leaders and residents that meet on a monthly basis, and from that group, individuals have been identified as circle keepers. They've been trained in restorative practices. They use a monthly meeting to strategize about improving things in their community. We've worked with the courts to infuse restorative practices into their operations. We're also working with the health department, some schools where we have youth ambassadors, and actually working with police and people who file complaints against police as an effort to help strengthen relationships. And I always tell people, you never waste a crisis, use it as an opportunity to build community. How do you do that? And using a community health model and the tools of restorative practices are the means by which we are accomplishing that. So I really look forward to being able to chat more with folks at the in July, and let you know about everything is not perfect yet, but we're not quite where we want to be, but we're definitely not where we used to be. And that is a strategy of building community across sectors and engaging the people who are being impacted. You know, one of the key components of restorative practice is fair process, engaging those who are going to be impacted by decisions. And we found some great success with that. So I look forward to having the opportunity to meet you all and to dive deeper into this. Thanks, Josh.
Thank you so much, Henry. So I'd like to turn to some of the questions. We've got a few questions, and if you have more, please do enter them in the question and answer section, which I think you find at the bottom of your screen, Q&A. Gina, a lot of folks are asking me that they'd like to see your talking points. They'd like to get some more resources about the things that you talked about. A lot of new information.
Mm-hmm. I can certainly draft up a very simple one-page summary. This is intended again as just a teaser for what we are going to be discussing during the 2019 IRP Symposium. So I do hope that you will join so that we can talk about these things in greater depth. I know that it was a lot quickly, but again, just want to give you a sense about where we are going. But sure, I'd be happy to do that.
Okay, great. Thank you. And we will send that out. I have another question here. Maybe this is for you, Henry. Someone's asking about tips for raising awareness. They work with churches in a denomination that is binational, Canada and US. How do I build awareness of the potential benefits of building a restorative culture? You're on mute, Henry.
There we go. My first response would be one, everybody you meet, everybody you talk to, talk to them about restorative practices. I found myself, I would be sitting, getting tires on my car. I'm sitting in the waiting room, and I'd ask somebody, have you ever heard of restorative practice? And the first response I remember I got, well, yeah, that's when you fix a house or something, right? I was like, no. So talk to all of your friends, those folks in your circles of influence. Then also reach out to community leaders there. If you're old enough, you remember E.F. Hutton. There was somebody that when they spoke, everybody else listened. Who are the E.F. Huttons in your community? Try and get time with them to share this idea, to have them thinking and talking about it. If you're in Canada, there's a lot of restorative work that's going on in Canada already. So I would, Josh mentioned our website earlier, iirp.edu. I believe if you go on there, IIRP Canada is there. Maybe Josh or John, if there's a different, is it just IIRP Canada?
Canada.iirp.edu.
Okay, I would encourage you to reach out to those who are in the Canadian community as well. But those are two ways that you can have immediate impact.
Okay. Thank
Josh, on the issue of religious communities as well, just to say some of the experiments, to Gina's points earlier, we've had the chance to do some just very limited initial experiments here in the States, but we have colleagues in Australia who've done this much more extensively. One way to work with really any community, but particularly, in this case, the question was religious communities, is as opposed to having something that feels amorphous, like I'd like you to care about this new social science that you haven't heard of. What is a real problem, issue, or challenge faced by the community that exists right now, to which they are actively looking for ideas or solutions? One of the things we're doing is working with the wake, with some parishes and religious communities in the wake of sexual abuse, for instance. Not working directly with the victims and the abusers in most cases, but working with the religious communities to say, in the wake of these incredibly traumatic histories, how do you give people who haven't had a chance to have voice or to talk about how they've been impacted a chance to be heard, not only by religious leaders, but also by one another, and doing that in communities where there's not a big or an extensive tradition of engagement even. And that is proving very interesting. So those are some of the lines of experimentation. We'll be actually, prior to our conference, in our world conference that we'll be holding in Bethlehem in October, this is after the symposium, we'll actually have two of the best experts in what's called listening circles, providing a pre-conference training around specifically listening circles for religious communities in the wake of trauma, but it works for other things too, like scandal or other traumatic events. So those are some of the things people can pay attention to as well.
Okay.
I would also say, I don't know if, so one of the other hats I wear, I'm also a pastor, and I would say for those, particularly in a Christian community, that this process falls right in line with the requirements. In 2 Corinthians 5, it talks about, I've given you both the word and ministry of reconciliation. You do that. This was particularly in that requirement and application.
All right. I thank you, Henry and John. So I have a lot of questions. I just want to say that if you're interested in getting more information, look at iirp.edu/symposium to find out more about the upcoming Summer Symposium specifically on community health and restorative practices. I'm going to try to get as many questions as I can. We have about 13 more minutes. Gina, I want to direct this to you. We had a question about UCID's university that is considering holistic bystander training for our undergraduates. Would love to hear more about restorative practices, programs, interventions that have been used on college campuses, which I know is a community you have a lot of interest in.
Sure. Thank you so much. So for 20 years before joining the IRP, I spent working in student affairs, and so on various campuses. And so this is a setting that is near and dear to my heart. And I'm actually going to be presenting with some other colleagues next week at the American College Health Association conference, where we're going to be doing a pre-conference workshop about restorative practices as it specifically relates to college health and well-being. And so one of the points that is going to be discussed is about the importance of using restorative practices, again, explicit restorative practices, to do two things: to build a culture of relationships, and also as a way for pro-social priming, so that when students are called to intervene in these scenarios, they are more likely to do so. And there is research to support that kind of priming does increase helping behavior. So we will be exploring that. And then, as I mentioned during the 2019 IRP Summer Symposium, we have built in time for people to work with others in their setting. So there will be a specific track for higher education folks to gather each day to now that we have introduced some of these concepts and connections between restorative and community health, how does this then apply from a practical perspective within your setting? So you'll have that opportunity as well.
All right. We had another question, which I think is probably for you, Gina. Can you contrast community health to population level health?
Sure, sure. So, and this is just the way that I see it. And there are many different ways of defining community health and population health. But for me, it gets back to the fundamental hypothesis of restorative practices, again, which is about doing things with and not to and for. And so community health, which is generally rooted in collective efforts of people to work together to promote health. Population health is more of an outcome-driven approach to manage health for a specific group of people. So to me, again, it gets back to that fundamental hypothesis of doing things with and not to and for.
Okay. Let's see. I have a question here about insight. What insight can anyone offer about working within healthcare communities, especially with healthcare staff? I'm not sure who to give that question to. John? All right, great.
I can do a little bit of it. One of the many hats I wore in the past, I was a crisis counselor, an emergency room crisis counselor for a local hospital for a while. I think one of the things to recognize, sort of like very similar to anyone working in a high stress environment, but especially other first responder type environments, is you're going to experience a lot of vicarious stress and trauma. I think a lot of times what happens is understandably, the focus of organizational training and to some extent well-being tends to be client and patient focused without as much of an intensive focus on the actual providers themselves. So I think, one of the, like Gina was saying, I think one of the differing perspectives is, it's not a completely radically new way of looking at it, but to say, look, the group of providers, say, in an emergency room, if you look at the little ecosystem that I was a part of, we had surgeons, nurses, staff, security personnel, psychological services, that we all also constitute our own small community. It's not the same as a community, even in another wing of the hospital, and certainly not out in the neighborhood. But what are we doing as an institution? These would be the right questions to ask to ensure that for one of these micro communities within our organization of whom we demand and expect quite a bit in terms of performance and intellectual, emotional, physical output. What are we doing to help them not only provide services to them, but to help them take care of one another organically in ways that the organization can sort of technocratically plan? I mean, it's one thing to say, we have an employee assistance program, and if people need something, they can avail themselves of it. But how do you make the environment within, say, an emergency room a healthy one, or at least the healthiest place it can be to show up to every day? Because staff are going to spend a lot more time in there than the patients ever will. And that, I think, is a perspective, and to see that not as an ancillary thing that's a part of human resources, but to see that as core to the mission and part of actually providing healthcare services, that's just as important as thinking about the patient experience as thinking about the provider experience. And I think you see that for institutions, even in many different fields, who begin to implement these ideas, you see that a very similar outlook of a much more high focus on the employee relational ecosystem as well as the people that you serve, because you really can't extricate the two things. And that can sometimes be the difference between, you could have two emergency rooms that by the data and demographics are exactly the same, but feel completely differently when you spend 8 hours there or 12 hours there, 5 days in a row. I hope that makes sense.
Great. I have another question here I'd like to take. Someone is commenting on, Gina, you're referring to restorative practices as being something that happens everything before the point of harm. And they're asking, how do you apply that in the case of epigenetic generational changes from adverse childhood experiences, implicit racism, negative health outcomes? So I think it's, if the harm has already occurred, maybe address that a little bit.
Mm-hmm. So to clarify, what I was talking about was primary prevention, right? And so being different from treatment and maintenance. And the guideline of restorative practices is that 80% should be done proactively in order to build community, so that people can have those very difficult conversations. I think about in Detroit, and in building that foundation so that these people who have had historical harms can come together and again have those difficult conversations, and then when things continue to come up, can deal with them appropriately. So again, it's truly a balance, but certainly not all of restorative is before the point of harm. My reference was about the primary prevention approach.
Okay, thank you.
Yeah.
I have a number of questions. What would be a good first step to bringing IRP to a community? It is a small rural community. Folks talking about bringing partner with IRP in schools. People talking about in the justice field. Does anyone want to talk in some general way about how the IRP partners or what people can do to get going?
Yeah, I mean, I think one of the great places to start is to start with the person who's already there, which is you. The person asking the question. You're already perfectly placed with all of the right relationships to make change. I think what I would suggest first is, before, and it can always be useful to bring us or others from outside to your community to help with certain things. But I think my suggestion would be have a look through some of the professional development that we have to offer, as well as graduate courses. And I think that will give you a sense of what assets you already have in place and probably already, comprise just you personally. And then I think that'll give you a better sense of what might be helpful on the ground. Some of the things we do most commonly, though, all of that being said, of course, we have a long history of working with school systems. School systems, one of the reasons we chose to work with schools, which was not even necessarily, the initial mission of the IIP wasn't just to be solely focused on schools. We chose to do a lot of work within education and continue to do so because it's one of the few social institutions that touches absolutely everyone. Even if you don't have children in school, the state of schools affects people pretty immediately, even in just your locale. So it's a way in which to have a social impact more broadly while working within a bounded system. We are also experimenting with, and to the last question as well, there's a lot of interest in this country, and we're beginning to do some experiments contending with multi-generational harm and histories. So for instance, I spent the last couple of months ago, I was in Canada meeting with some First Nations and Aboriginal communities, along with, people of European descent in Canada, trying to come to terms with the long-term trauma that Indigenous communities have faced. Similarly, in the US, we're at the beginning of talking about some partnerships with some local organizations just to help with local histories of, the racial trauma here in the US. How do you have, in a small town where people know one another, including they probably even know some of each other's family histories, how do you come to terms with several hundred years of inequity face to face in a way that actually strengthens the relationships of the people that you do intend to live with or around for the rest of your life? There's a revitalization of interest in the truth and reconciliation process. Now, that was a long, the most famous case being what happened in South Africa. But I think, in a new way here, the way I see the new developments around those ideas developing is, whereas some versions of that I think were very expert driven and large national commission driven. What if you had a much more usable technology that was easy to understand, doesn't require even necessarily formal education or a high level of education, that communities and individuals themselves could own? So that at a very grassroots level, you could have, quote unquote, very much regular people, who don't think about these things all day long. You could help people have more direct reparative experiences with one another, or at least just build understanding about each other's world. So we're interested in those sorts of experiments too. So if your community is one of them, that's something we'd be interested in talking to you about.
All right, I know I said we'd stop at 1:45. I'm going to try to squeeze in one more question for Henry. It's actually two questions. This one says, I'm a small rural restorative practices organization. We do court diversion work, school programs, want to build a community program. What kind of activities have others done in this regard? And I want to couple that with someone from Barcelona University who's asking about how to handle police complaints. And I think these are some things you guys have worked on in Detroit.
Yes, let me tackle the last one first. Police community relations is key. We talk about the role and responsibility of both citizens to officers and officers to citizens. And so we host a police community summit where people who have actually filed complaints against officers get to meet with officers, and it's a 6-hour session. And we've had epiphanies both on the part of police officers and citizens as a result of that. So again, it gets back to the core issue that relationships are critical, and creating the environment for healthy relationships is what's going to make for a civil society. So implementing a restorative framework helps to address that, which makes it a healthier environment both for officers and for citizens. Someone else, I think, had asked a question about the race issue. This framework creates an environment where you can have those genuine discussions and come away minimally having better understanding. Sometimes the folks, it just creates a space where you can have great conversation around difficult questions. So whether you're in a rural area or an urban environment, if you have people, it works. Urban folks, suburban folks, rural folks, the commonality is that they're folks. And they harm each other, need restoration, and this creates the space for that.
All right, I'm pulling everybody up on the screen just to do a farewell. Thanks so much to John Bailey, Gina Abrams, Henry McClendon, and everybody who participated. We really appreciate your taking an interest in this subject. If you want more information, it's at irp.edu/symposium. I'm going to go through all the questions that didn't get answered and try to get back to people on those things. And again, thank you so much, and we'll see you soon.